The World Health Organization created a campaign called Save Lives, Clean Your Hands to raise awareness for hand hygiene and patient safety. Save Lives, Clean Your Hands. WHO's global annual call to action for health workers. Each year, the Save Lives, Clean Your Hands campaign aims to progress the goal of maintaining a global profile on the importance of hand hygiene in healthcare and to bring people together in support of hand hygiene improvement globally. World Health Organization state, hand hygiene is a simple act that grows into big changes. Simple infection prevention actions such as hand hygiene is critical to ensure patient safety in several healthcare delivery situations. Through integrated strategies, infection prevention and control also significantly contribute to other priorities such as stopping the spread of antimicrobial resistance and outbreaks. Overall, hand hygiene and infection prevention and control ensure quality of care in the context of universal health coverage. For many years, it's been recognised that efficient hand hygiene techniques are paramount in ensuring that the spread of infection is dramatically reduced and that our patients are treated in a safe and clean environment. Our hands are covered with many transient microbes, most of which are harmless and live in harmony with our skin. However, some of these bacteria are pathogenic and can cause harm to patients and staff. Because of this, hand hygiene is an important part of our daily environmental cleaning processes. If efficient hand hygiene procedures are not performed adequately, then the risk of cross-contamination in categorised risk areas is far greater and poses a risk of infection to patients and staff. Microorganisms fall into two categories known as resident and transient flora. Studies show that the number of bacteria can vary dramatically between individuals. Resident flora describes microorganisms present on our skin and are generally not harmful to us or others. They help keep our hands healthy. Transient floras are those pathogens which can be acquired during the working day that can be easily transferred from patient to patient via the hands of healthcare workers. Some common examples of these include MRSA and C. difficile. Subsequently, they can lead to harm and can be potentially life-threatening to individuals such as the elderly and immune-compromised. Facts about transient flora. These are the microorganisms most commonly associated with healthcare-associated infections, HCAI. They can attach themselves loosely to the skin and the environment, enabling them to be easily transferred. The removal of these microorganisms can be easily achieved with frequent and efficient hand hygiene techniques. They persistently colonize, formation of many of the same type of microorganism on the outermost layer of the skin. Facts about resident flora. Resident floras embed deeply into the skin and hair follicles. They help keep our hands healthy by having a protective function. They cannot easily be removed by routine hand hygiene techniques. They are less likely to be associated with HCAI. Hand hygiene is one of the most important methods of preventing cross-infection, as hands are one of the main pathways for spreading bacteria. All dental care professionals are required to carry out hand hygiene prior to dental treatment. Hand hygiene should be an integral part of staff induction, and regular audits should be carried out. The use of gloves does not replace the need for cleaning your hands. It's important to be aware that gloves worn for procedures cannot be 100% reliable and may have flaws not visible to the naked eye, which is another reason that hand hygiene should be performed effectively after removal of gloves. As per HTM 0105 Section 6, all dental practices should provide the following. Training in hand hygiene must be part of the staff induction and provided to all relevant staff within dental practices periodically throughout the year. Liquid soap and antimicrobial hand rub should be available and dispensers sited on or adjacent to the hand washing sink. Disposable paper towels for hand drying should be used. Wall-mounted hand cream dispensers with disposable cartridges should be used. A cleanable poster should be displayed above every clinical hand wash basin in the practice. Separate dedicated hand wash basins should be available. HTM 0105 2013 edition, Section 611. Wall-mounted liquid hand wash dispensers with disposable cartridges should be used. It should be ensured that the nozzle is kept clean. Refillable hand wash containers should not be used, as bacteria can multiply within many of these products and are therefore a potential source of contamination. HTM 0105 2013 edition, Section 65. Mild soap should be used when washing hands. Bar soap should not be used. Apply the liquid soap to wet hands to reduce the risk of irritation and perform hand washing under running water. Ordinarily, the hand wash rubbing action should be maintained for 15 seconds. After the exercise, the hands should be visibly clean. Where this is not the case, the hand hygiene procedure should be repeated. What not to wear? Resident and transient microorganisms can reside in many areas of our hands. It's important to understand that it's not just our hands that can transfer these microbes, but also what we wear on them. Pathogens can be easily transferred not only from patient to patient, but on leaving the workplace can be transferred to our home environment. It should be considered wherever possible that a bare below the elbow policy be adopted to ensure effective hand hygiene is carried out every time. Working bare below the elbow encourages effective hand hygiene. Jewellery, wristwatches, false nails and/or nail varnish should not be worn at any time when working in a clinical area. Nails should also be kept short, no false nails or nail varnish, and cuts should be covered with waterproof dressings. Why is this? When wearing jewellery, this provides a rough and uneven surface, providing a suitable environment for pathogens to reside and therefore act as a reservoir for microorganisms, increasing the risk of transmission of infection. It's acceptable to wear a smooth wedding band, providing it's removed during the hand washing procedure and any residue removed from underneath. Separate dedicated hand wash basins are required where clinical practice takes place, i.e. in the surgery. Where decontamination takes place, if this is a separate room to the surgery. All basins should meet the following requirements. The basin should not have a plug or an overflow and be fitted with a remote running trap, that is, the U-bend is not directly under the plug hole. It should have a sensor-operated or lever-operated mixer tap. Taps should not discharge directly into the drain aperture, as this might generate aerosols. When should hand hygiene be performed? There is no set frequency as to when adequate hand hygiene should be performed. However, the basic rule should be applied. 5 moments for hand hygiene. Before patient contact, before a procedure, after a procedure or body fluid exposure risk, after patient contact, after contact with patient surroundings. There are many other opportunities for hand hygiene that can significantly reduce the risk of transmission of microorganisms. That is why it's very important to think about what you've been doing and what you're about to do. HTM 0105 Section 6 refers to all aspects of hand hygiene with regards to clinical procedures in a dental practice. and explains in detail not only how to clean hands effectively, but the importance of good care of hands following hand hygiene. As part of the essential quality requirements, it's important that hand hygiene should be included in the induction process and that all staff are aware of the importance of hand hygiene within a dental practice. All staff training in this subject should be documented and included in the infection prevention and control record within your practice. Hand hygiene technique. A standardized hand hygiene technique should be used to ensure that all surfaces of the hands and wrists are exposed to the soap or disinfectant and are thoroughly cleaned in a systematic manner. The different methods of hand hygiene. There are 3 main methods of hand hygiene, including social, clinical, antiseptic, surgical. Social hand hygiene is carried out to physically clean hands before cooking, eating, or after using the bathroom. Social hand washing uses a general-purpose liquid soap and warm water to remove dirt and organic material, dead skin, and some transient organisms. This hand wash usually takes 15 seconds. Clinical, antiseptic hand hygiene is carried out to destroy microorganisms with the use of an antiseptic or antibacterial liquid soap. This type of hand washing should be carried out at the start and the end of every clinical session. Hand washing should be performed in a designated hand washing sink, which should not have a plug or an overflow. It should be carried out for a minimum of 15 to 30 seconds if using plain or antibacterial soaps. It's important to always wet hands prior to applying soap, as this flattens the skin cells and will ensure that the risk of irritation to the skin is kept to a minimum. Drying hands also helps maintain skin integrity and prevent skin damage. It's important to remember that drying hands also helps to maintain skin integrity and prevent skin damage. Microbes grow faster and are shed in great numbers from damaged skin. Surgical hand hygiene is carried out to significantly reduce microorganisms before invasive or surgical procedures using an approved antibacterial liquid soap. This hand wash will take a minimum of 2 minutes, and the hand wash should extend from fingertips to elbow. How to hand wash with soap and water. 1. Wet hands with water. Apply a palmful of the product in a cupped hand and cover all surfaces. 2. Rub hands palm to palm. 3. Right palm over left dorsum with interlaced fingers and vice versa. 4. Palm to palm with fingers interlaced. 5. Backs of fingers to opposing palms with fingers interlocked. 6. Rotational rubbing or left thumb clasped in right palm and vice versa. 6. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. 8. Rub each wrist with opposite hand. 9. Rinse hands with water. 10. Use elbow to turn off tap. 11. Dry thoroughly with a single-use towel. 12. Once dry, your hands are safe. HTM 0105 Appendix 1 Hand Hygiene Policy states bar soap must not be used or made available in the practice. Can you use alcohol-based hand rubs? It is deemed acceptable to use an alcohol-based hand rub in certain situations, for example, before and after the removal of gloves, in between patients, etc. These circumstances should be risk assessed and agreed in your area as part of staff training and induction. It's also important to be aware that alcohol-based hand rubs should not be used if hands are visibly soiled, and therefore soap and water should be used when performing hand hygiene in this circumstance. Alcohol-based hand rubs should not be used on gloves as they can damage the material, and they must conform to BS-EN 1500 standard. The hand rub procedure is the same as hand wash, apart from there is no need to wet your hands initially or dry them at the end. Moisturising is an essential part of a complete hand hygiene regimen. A moisturiser should be used regularly to protect the skin from dehydration and damage. HTM 0105 Section 6.7. Hand cream, preferably water-based, should be used to avoid chapped or cracking skin. Communal jars of hand cream are not desirable as the contents may become contaminated and subsequently become an infection risk. Ideally, wall-mounted hand cream dispensers with disposable cartridges should be used. Any staff that develop eczema, dermatitis or any other skin condition should seek advice from their occupational health department or general practitioner (GP) as soon as possible. Thank you for watching this hand hygiene video. You can now read through the course content in full, replay the video or take the assessment.